very good morning to all the viewers. My name is Richa and I welcome you all to We Talk Do You Show, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Human Biologicals Institute, a division of Indian Immunologicals Limited, shaping global healthcare by spearheading the One Health Initiative. So, the One Health Initiative talks about optimum health of animal, people, and the environment. IIL was established by the National Dairy Development Board NDDB in 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biologicals Institute was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to have rolled out first varicose culture rabies vaccine in 2000. Subsequently, Human Biologicals Institute launched other vaccines and currently we are the major player in human vaccines. Leader in anti-rabies vaccine segment and present in around 50 countries. 3 state-of-the-art manufacturing facilities at Ooty, Gachibowli and Karkapatla, also known as Genome Valley. Human Biologicals Institute has forayed into the market of clinically proven wellness products and infertility range of hormones. While coming to our vision, mission, and values, our vision is shaping global healthcare by spearheading the One Health Initiative. While coming to our mission, it is to innovate, produce, and market quality healthcare products and services to improve and extend the lives. While coming to our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As we know, we are a kind of company who will definitely look after taking care of environment as well. We proudly bring before you the Green Initiative as we have launched our flagship brand anti-rabies vaccine Abhairab in an eco-friendly pack. And with this, we could reduce 160 tons of plastic per annum. Now, as a company, we don't just manufacture and market the products, but Human Biologicals Institute has done a lot in the corporate social responsibility and have taken up various projects. One such project is adoption of government schools. We have adopted 2 government schools in Karkapatla facility and totally revamped the facility and given private infrastructure to these government schools. I mentioned the strength of these 2 schools have been doubled. Our other program is Gift Milk Program in coordination with NDDB. We are giving additional nutritional supplement to over 1600 school-going children of Telangana and Tamil Nadu. And as we know, we are into the field of rabies. We have tied up with FIAPO, Federation of Indian Animal Protection Organization, to make Thiruvananthapuram rabies free. You can follow us on www.indimmune.com. Our toll-free number is 1800-313-999977. You can follow us on LinkedIn, YouTube, Facebook, Twitter, as well as Insta. And you can visit us at www.fearlessagainstrabies.com, www.pubertytomenopause.com. Puberty to Menopause is yet another awareness platform created by Human Biologicals Institute where we try to provide the expert medical advice and create awareness on women's health. Today, once again, I welcome you all to yet another interesting topic of discussion, prenatal care. Why is it important for mother and child? With Dr. Geeta Jaiswal. Dr. Geeta Jaiswal is a renowned gynecologist working at Pragati Hospital, Varanasi. She has a rich experience of over 18 years. She completed her degree from Bharati Vidyapeeth College, Pune, and has treated good number of patients for infertility with positive results. At the outset, we are pleased to have such an experienced doctor with us today to discuss on a very important topic, prenatal care, and why is it important for mother as well as child. Our heartiest welcome to you, Dr. Geeta, and we are so pleased to have you here and to have a discussion on a very important topic, Doctor, prenatal care. So, for our viewers to understand it better, Doctor, I would like you to just introduce the topic to our viewers.
Thank you, Richa. Thank you for the warm welcome. Actually, prenatal care itself is a very important part of a woman's life as it reduces the complications during pregnancy and prevents problems during delivery. So, what actually prenatal care is the periodic and periodic checkups which a pregnant lady should get, and she should be aware that she has to visit her healthcare provider at regular intervals so that her pregnancy is complications free and there is no problem at the time of the delivery. As pregnancy itself provides you with the vital information, like it maybe what changes you're having in your body that could be put pregnancy or your health at risk. So basically, prenatal care is the regular and periodic visit you should pay to your healthcare provider.
Okay. So, doctor, as you have explained what is prenatal care, so I would like to just know from you why prenatal care is so important for a mother. Means what are the advantages which a mother can get out of prenatal visits and all these things.
Yes, it is very important prenatal care because good care during pregnancy is important for the health of the mother and the development of the unborn baby. So, crucial time to promote healthy behaviors and parenting skills in you. So, prenatal care, it links the woman's and her family with the uh, healthcare system and how she'll get the best possible aid at the time of delivery, and there should be some skilled attendant present at the time of her labor pains, and everything on the total, it contributes to the good health through the life cycle of the woman as well as the child which is to be
Okay.
born. So, prenatal care itself is the most important part of the pregnancy.
So, doctor, whenever would-be parents come to you, so how do you counsel them for prenatal care, Doctor Geeta? Dr. Geeta, am I audible?
Yeah, actually, counseling to be parents is very important. I'm not audible.
Ma'am, your voice is, breaking in between. So if you can repeat.
Hello.
Dr. Geeta, your voice is breaking in between, ma'am.
Okay, like uh, counseling of to be parents is very important part of prenatal care. Pregnancy, it comes with excitement, and no matter how eagerly a child's birth is anticipated, stress and anxiety, other forms
Geeta, ma'am, we are unable to hear you. It would be better
counseling
if
of
you
to
can
be
join
parents.
back. Yes, ma'am. Now I think it is
Now
fine.
also,
Yes, ma'am. Geeta, ma'am, you can rejoin again, I
hello.
think.
counseling of the parents to be is very important because of the part of the prenatal care. Like, I haven't left. I'm there. Hello.
Yeah, Geeta ma'am. Yeah, now you are audible, ma'am. We can go ahead.
Now,
Yes, ma'am. Ma'am, I think
is a
some
very
internet
important
issue
part
is
of the
there
prenatal
at
pregnancy.
your end, maybe. So you can join back, ma'am. I'll wait.
Okay, fine.
Yeah. So, as we all know that, motherhood is undoubtedly the unmatchable stage in a woman's life and, a kind of experience which a woman cherish and preserve for her whole life. And every mother have her own experiences which are very different from each and every lady. Every mother has her own journey of motherhood, and every mother wants her baby also to be very healthy and fit and fine. So for which prenatal care is very important, highly important. Dr. Geeta has joined with us back. So yeah, ma'am, of course, how do you counsel
Yeah.
to be parents?
But on the point, counseling of to be parents is very important part of the
Yeah.
prenatal care. And pregnancy comes with excitement, and like no matter how much the child's birth is eagerly anticipated and we wait for it, but it also comes with stress and anxiety, and some form of emotional disturbances are still there. So counseling of, I always prefer calling the couple together so that we can counsel both of them. It might lead matlab, which will be like they have this counseling also affects the health of the mother and the unborn baby. Like, we have to tell them there might be disturbances in your partnership once the baby is born, how to manage everything postpartum, how to take care of lactation and other your health issues. And sometimes they have the fear of becoming parents, how we will manage that. So we have to counsel them regularly at short intervals, that it's a very natural way, it's nothing new you're going to be. So this is very important. They have fear. There is the word called baby blues is an expression in which you are like, there are your mind is low, and you get irritable very soon. So this counseling is also very important of the parents, and some might have financial issues as well. So we have to tell them how the pregnancy will go, and what will be the mode of like delivery, what you have
Yeah.
to be like prepared with. And then the immunization schedule of the child post partum, we have to tell them that you should be very cautious with that. Not only delivering the child is important, taking care is also very important after that. So, and I think we have to deal with some of the minutest issues also with the couple. What anxiety they have, or and what are the questions which are in their mind, like how the things will go. So this is a very important part. And side by side, we have to be very particular about that these are the regular and periodic checkups which are to be done. So you will
Right.
be registered. Yeah, this way, the counseling is very important of both the parents.
Dr. Geeta, if suppose prenatal care is not, well taken care, so what all are the complications which can come up for a mother as well as for a child? So if you can just tell more on
Yes,
this.
sometimes it leads to like very dangerous outcomes are there. If the mother is not given proper prenatal care, 3 times she is more likely to have a low birth weight baby, and 5 times the baby is likely to die as compared to those who are given the proper prenatal care. Like, your doctor can spot your health issues very early and can guide you how to go through the full pregnancy term, like what all you have to take care. If you have any underlying diseases, already you are hypertensive, or you are diabetic, or you are anemic. So these complications can be avoided. Like we should have mother and child both should be safe at the end of the pregnancy. Both should be safe. जच्चा बच्चा दोनों का स्वास्थ्य जरूरी है. So like it's like that. So one should be very particular, otherwise you have to face the complications. Even if you follow 75% of the prenatal care advice, I
Yeah.
think you deliver a healthy baby, and there is not much complications you have to face.
Right. So means, doctor, what you have said, it can be even, fatal for the newborn baby.
Yes,
So
yes,
it
it
is
can
that
be
much
for both
important.
mother and baby. Yeah.
Yes. So, डॉक्टर लो बर्थ वेट जब आप बात करते हो, सो व्हाट इज लो बर्थ वेट एंड कब हम बोलते हैं कि बच्चा लो बर्थ वेट है, और उसके कारण और क्या कॉम्प्लिकेशंस आ सकते हैं उस बच्चे के लिए, मे बी इन फ्यूचर एज वेल?
Yeah. According to WHO, baby weighing less than 2,500 grams is considered to be low birth weight baby.
ओके.
It can be an outcome of anything. You are not getting the proper vitamins, or you have any other health issues which are not taking you and the baby to a proper desired health. So
या.
in that case, like weight is an indicator of baby's well-being at the time of the delivery. Babies who are less than 2,500 grams, they may die in infancy, or they may have some issues, like physical and neurological lesions. And at the time of labor, if
या.
low birth weight babies, they suffer acute respiratory distress syndrome, and it is very difficult to save them. Then you have to send them to an ICU and get
या.
the thing done. And even the mother, even if they survive, you are facing problems with them. Like they
राइट.
cannot their weight gain is a very big problem. Other health issues are there. They might it might lead to cerebral palsy in future if proper brain is not developed.
या.
So low birth, our aim should be that the baby weight should be more than 2,500, or at least 2,500 grams when
यस.
the pregnancy term is complete.
Yeah.
Yeah.
Uh, Very well explained, Dr. Geeta. So, ma'am, what are the small tips, or I can say suggestions you would like to give to would-be mothers, so that they can take care of themselves in a better way, and whenever they are meeting their gynecologist, so they can also discuss in a proper way, because we all know that most of the women are now educated. They also
Yeah.
understand how important is their health as well as their child's health. So, how you would like to explain them that they should tackle their pregnancy complication or pregnancy journey?
Okay. WHO has has set some limits for this. They say at least pay 4 visits to your healthcare provider during these 9 months.
Mhm.
First visit, and my tip will be you plan out that I have to visit minimum 4 times to my doctor, and
Mhm.
if required you can visit more also, that's not an issue.
Mhm.
And the first visit you should pay when you miss your first period, and that is matlab that will include first 3 months.
Mhm.
Second visit you should plan from fourth to sixth month. Third visit from seventh to eighth month, and the fourth visit will be at the ninth month, when you will be made aware of the things. Get 2 doses of tetanus toxoid, okay, administered at an interval of 1 month. And always get your vitals checked whenever you are visiting, your blood pressure, your temperature, your oxygen levels, everything. And the abdominal examinations which the doctor will conduct will make her and you as well aware about the baby growth. The abdominal girth is increasing, and what are the issues, you are not feeling any multiple fetal parts. And if advisable by the doctor, get ultrasounds as well done, at least thrice uh, during the 9 months. And get all your blood tests at the first visit. She'll ask you to do your hemoglobin, group RH, general, and they are must. Don't ever ignore them, because just in case you are your blood group is negative, you have to administer anti-D immunoglobulin. So all these are very minute things, but do get them done. That's like earlier I said, even if you follow 50 to 75% of the prenatal care which is advised, I think there are no complications, and you don't need any major like ICU management. So, and maintain hygiene. Don't overeat, because it might lead to weight gain and other issues. And
Yeah.
it's only that you require one extra meal a day. Never
Right.
skip your breakfast, and always be like happy. I think being happy, mental and social well-being should be
Right.
fine. You should have a good connect with your family members, so that you can say and be aware of the dangerous sign. Like if you
Mhm.
you can see there is some spotting or any which kind of vaginal bleeding, you have pain in your abdomen, or like fever, or you're breathless, immediately visit your doctor. Don't
Yes.
linger on. Yeah, the
Hmm.
things, so that the things should not be complicated.
Yeah. Thank you so much, Dr. Geeta, for explaining it so well and so simply. Ma'am, this is time for us to take few questions also, which has come up from our viewers.
Yeah.
So I would like to just take it one by one. Doctor, one of our viewer is asking that uh, for the pre-eclampsia, what do you advise for during the prenatal care for pre-eclampsia cases?
Yeah, preeclampsia is the problem where your endothelial lining it gets increased, and which will show many problems like proteinuria, edema, blood pressure
Yeah.
will be high. So that's what I said. When you are first visiting your doctor, get all your blood tests, simple urine. If there is protein, be careful, and your BP should be under control. If your diastolic BP is more than 90, you have to monitor it. There are some diets which are advised, because preeclampsia is life threatening if it
Yes.
is continued, if there is edema. So one has to be cautious. There is no perfect treatment is like which is uh, given for the preeclampsia. Only you have to measure, like monitor your blood pressure, any edema, proteins in the urine, all these things.
Okay. So, fine, ma'am. We would like to take another question. Doctor, I have been suffering from endometriosis and then I got pregnant. So, what are the precautions I should take during this time, during pregnancy?
You were like aware, if you were aware of the endometriosis, you should get the treatment done first for it, and then
Okay.
you should get pregnant. I will advise this. So
Yes.
for these, like for this, these days we are also giving preconceptive care also,
Okay.
pre-pregnancy care. So one should be careful if that is not creating any much of a problem, like you'll have abdominal pain throughout your
Okay.
pregnancy if you were having endometriosis. And I think you have to consult the doctor you are undergoing the treatment. She will continue the some medicines for that, but always be careful. Don't conceive if you have any underlying diseases, because treating endometriosis and carrying on forward your pregnancy simultaneously is very difficult. So
Yeah.
first get treated for it, and then you should get pregnant. That is why like I said, pre-pregnancy care is also coming into picture these days a lot.
Yes. Fine, ma'am. Doctor, one of our viewer is asking that a few of the doctors suggest
You're not
exercises
audible, Richa.
before delivery. Am I not audible, ma'am? Am I audible, ma'am? Geeta, ma'am, am I audible? Now, ma'am, am I audible? Hello.
Yeah, now you're audible.
Ma'am, one of our viewer is asking that few of the doctors suggest few exercises before the delivery. So, should I follow those exercises or practice those exercises during pregnancy?
Yes, you can. I think the best exercise is simple walking.
Yeah,
For like 15 to 20 minutes, you take a stroll leisurely. Don't do any strenuous type of exercise. And these days, like we do ask our patients to meditate so that the anxiety and the depression which can be controlled. But those Kegel exercises, they are called, of the like lower abdomen and all, and your pelvic floor to relax them, you can do them, but always get it supervised by your doctor. Like they
yeah,
should tell you, then only continue. Otherwise, the work which you are doing during your like daytime, your physical activity, that itself will be your exercise, I think. If you're not, don't lift any heavy weights, don't do much up and down on the stairs. And I suggest my patients to just walk simply.
okay. Means
Yeah,
when walking is the best exercise to be
that's the
done
best
during
exercise.
pregnancy.
Yeah, it will relax your pelvic floor muscles very well.
Yeah.
Yeah, and be
Uh,
active. Don't take
yes.
rest too much. Like I have
Hmm.
seen the laborers who work throughout the day and they
Right.
deliver normally at the end of the like
Right.
term pregnancy. And I
Yes.
find it really strange ki how do, like, they are not advised any bed rest and all. So it's like, listen to your body. What your body is asking you to do.
Yes.
Yeah,
Yes.
that should be more important.
Even, ma'am, a few of the doctors also shared with me that many ladies they think taking bed rest and all for most of the hours is really good for my health during pregnancy, but it is very, not at all indicated.
No, you
So
should not
yes,
do complete bed rest unless until advised. Like there are problems of placenta previa in which
right.
you have painless bleeding, which is life threatening sometimes. You
Mhm.
have high blood pressure. I think one should be normal, stay normal, but with caution during your
Yeah.
pregnancy. That
Yes.
what can harm me? Look, everybody knows. If I eat this might cause me heartburn. तो जो पहले होता है वो प्रेगनेंसी
Mhm.
में भी होता है, ऐसा नहीं
Right.
है.
Right.
बट यू टेंड टू बी मोर कॉशियस कि ओ आई एम ईटिंग दिस, आई एम हैविंग अ नोजिया फीलिंग and
Hmm.
my I'm having heartburn. So you yourself know your body very well.
Yes.
Don't do any strange things like
Correct.
eating too much or eating less. Be normal, behave normal, take cautions, and malab, be precautions should be taken, but
Yeah.
lead your life the way you're living. And
Hmm.
Paki, rest, your doctor will advise you what all things you have
Yes.
to avoid. Yeah.
Ma'am, one very interesting question has come up. Like, I think the viewer wants to ask that, like, we counsel mothers. So, how do you counsel a father?
Yes,
As soon as the
very
delivery
important.
happens. So, how do you
Yes.
counsel a father as well?
Richard, these days, couples therapy is a very good initiative which is being taken by some of the gynecologists,
Yes.
because having a baby will might, it can change your romantic partnership. You will be anxious, you will be depressed, like how to give time. So even the fathers are counseled.
Yes.
That's why I say that I call the couple together. You visit, we'll explain you everything. Like
Yes.
it's not that something new you're going to do.
Yeah.
Even you were brought like this into the world. Your parents, they nurtured you.
Yes.
So counseling a father is also very important. Be prepared. You are
Yes.
the 50% partner
Correct.
of the child. So it's
Yeah.
not only like female's responsibility
Responsibility, right?
to do that. Yes, it is very important. And basically, the fathers, they have financial issues, like how it will go. So it's the counseling of father is very important. I think everyone, like, they should visit together. On
Yes.
every visit, both the partners should come together. They should be aware of
Yes.
like what my wife is facing and everything. Yeah.
Doctor, even one of our viewer has asked that is intercourse allowed during the pregnancy? This is, yes, I could say a valid question which every couple has, but they don't open up.
It is not that safe, but if you like can't control your emotions, then it is advisable in the second trimester. First trimester and
Okay,
last trimester, it should be avoided.
it should be avoided.
Yeah.
Ma'am, one of our viewer is asking that How to handle back pain during pregnancy?
Okay.
Yeah,
Back pain is basically your abdominal, like girth is increasing. It leads to lordosis. So that's what I said. Like if you are visiting, your healthcare provider, she'll guide you with everything, like how to relax your back, how to give it support. So
yeah,
backache, and you should continue with your calcium supplements, because iron and calcium supplements are very important. There is loss of calcium, like from the bones of the mother. And you relax, not much to panic. You can
yeah.
apply some local liniments and all. That is done.
Uh,
If
Geeta
blood
ma'am,
goes
one
low.
query. Yes, sorry to interrupt, ma'am. One query from my side as well. Ma'am, is it okay to take few kind of medications during pregnancy, like if somebody gets some viral fever, or even for the back pain, also taking,
No,
painkillers and all those
no.
things?
Painkillers are not advisable to be
Okay,
taken. You
okay,
get your calcium and PK, everything checked. If they are less, the supplements will be increased. And use local, like liniments, fermentation. That is the best. And rest.
okay.
Yeah.
So it is better to, recover naturally rather
Yes,
than going
yes,
for any
yes,
sort of
yes.
medication.
Because when, like, just imagine our ancestors, how the things were done.
Yeah.
This is not new. This is being like, this is going on since ages and ages. So there were no calcium, no iron at that time, but
Yes.
everything was happening now. So go the natural way. That's the best thing. And
Yes.
just take precautions. That's it.
Yeah. Thank you very much, Dr. Geeta, for taking out your time and coming here with us and sharing your expert guidance. I am very well sure, ma'am, the way you have explained and the tips which you have shared are very much helpful for our viewers as well. So I thank you wholeheartedly, ma'am, on behalf of Human Biologicals Institute and my whole team for coming over here and taking out your time.
My pleasure.
Uh, yeah, thank you, ma'am. So we are coming to an end of our session, ma'am. So again, I would like to just interact a few minutes with my viewers. So to all the viewers, I once again, on behalf of Puberty to Menopause, a Women Health Awareness Initiative by Human Biologicals Institute, I wholeheartedly thank to all the viewers. We request all of you to visit us on www.pubertytomenopause.com for more information on various health aspects of women at different stages of life, and follow us on Facebook, Twitter, Insta to get more and more updates on health as well as live talks with the expert doctors across the nation. Till then, take care of yourself, and no doubt, being pregnant is a very, very, mesmerizing experience in a woman's life, and for which, yes, prenatal care is very much important. So, as Dr. Geeta suggested, that prenatal care is a vital, vital part of, I could say motherhood. So while you are pregnant, do follow all the advices given to you by your gynecologist without going, I could say, don't rely much on the Google search as well, because that is also somewhere misleading. So it is always better to trust on your gynecologist and do all the things which she has, told you to do. Giving my best wishes to all the pregnant ladies, and may you all have a very healthy baby and have a very, good experience of motherhood. So, Dr. Geeta, thank you very much, ma'am, for being here with us today. Thank you.